For nearly 40 years, research into psychedelics as a treatment for mental health was practically non existent. Back in the 1960s, controversial figures like Timothy Leary encouraged the public to turn on, tune in, drop out. The resulting political backlash from the government effectively killed the funding and the science. Instead, we spent the next few decades relying on traditional antidepressants like SSRIs, which is a process likened to dumping buckets of serotonin into people's brains. While these drugs help many, they can take 8 to 12 weeks to kick in, leaving those with severe depression waiting months for relief. But what if we could achieve lasting results in just a few minutes? Enter a new Phase 2A clinical trial looking at a short-acting psychedelic called DMT. You might know DMT is the active ingredient in ayahuasca. It's dimethyltryptamine. But while ayahuasca experience can take hours to kick in and last all day, intravenous DMT hits the system in seconds and is completely over in roughly 30 minutes. Because of its incredibly short half-life of just about 5 minutes, IV DMT offers a massive practical advantage. It allows for much shorter therapeutic sessions without tying up clinical resources all day. In this double-blind, placebo-controlled study published in Nature Medicine, researchers took 34 patients with moderate to severe major depressive disorder. Patients received either a placebo or a single 21.5 milligram dose of DMT infused intravenously over exactly 10 minutes. Both groups also received structured psychotherapeutic support, talk therapy, before, during, and after the experience to help them integrate what they felt. Later in the study, participants were given the option of an open label phase where everyone, including the placebo group, had the chance to take a dose of the real drug. The results were staggering. At the 2-week mark, the group that received DMT showed a rapid and statistically significant reduction in their depression scores compared to placebo. Even more fascinating, the antidepressant effects persisted up to 3 months. And when researchers compared the patients who took 1 dose versus those who took 2, they found no significant difference. A single dose was enough to maintain the benefit. As for safety, the side effects were mostly mild to moderate. Some infusion site pain, nausea, and transient anxiety, understandable if you suddenly find yourself in outer space. Notably, there were no serious adverse events, and none of the lingering headaches sometimes associated with other psychedelics like psilocybin were noted. For patients dealing with severe refractory depression, especially those who simply don't have the time to wait months for traditional medications to work, this 10-minute intervention could be a life-changing breakthrough. I'm Dr. Steve, and see you next week for another edition of Dr. Steve Presents.